This is Abia COVID-19 update. Abia COVID-19 update. Well, we are seeing hundreds of new cases every day with sustained community spread. The epidemic is still increasing, but not exponentially. In the meantime, test capacity is still increasing, but testing is not being done enough for several reasons. There is stigmatization of people with COVID-19, and some states are not as proactively pushing testing as they should. The spread of COVID-19 is most likely to happen where there is close contact less than 2 meters with an infected person. The risk increases the longer one has close contact with an infected person. So there are two routes by which people could become infected with COVID-19. Secretions can be directly transferred into the mouth or noses of people who are nearby within 2 meters, or could be inhaled into the lungs. It is also possible that someone may become infected by touching a surface or object such as a doorknob that has been contaminated with respiratory secretions, and then touching their own mouth, their nose or eyes. And based on current knowledge of the disease, some category of people are also considered vulnerable and at high risk of complications of COVID-19. I have talked about that severally on this program, Abia State COVID-19 update. I'm going to reel out those people in that category again. Persons aged 50 years and older with or without underlying illnesses. Persons with critical underlying medical conditions such as diabetes, cancer, lung disease, liver disease, moderate to severe asthma. Also other persons who have been assessed as vulnerable based on a clinical assessment. If you or your loved one is in any of these categories, the category of vulnerable populations, there is a higher risk of complications from the COVID-19 infection. However, there are measures that can be taken to limit possible infection. Use non-contact greetings, like even with your family members, washing your hands regularly with soap and water, or using an alcohol-based sanitizer. If no water or soap is available, use an alcohol-based sanitizer. Avoid contact with anyone who is showing symptoms of COVID. COVID symptoms are also related with malaria symptoms and also related with the common cold. So it's very important you avoid contact with those that are sick. Close contact, it's not advisable. Avoid non-essential outings and visitors. If you must go out, always wear a face mask in the public. We keep hammering this every weekday right here on this program, and it is important that you keep following these precautionary measures so that we can flatten the curve of coronavirus. Maintain at least 2 meters of physical distancing between yourself and other individuals, and avoiding large gatherings, also very important, and crowded spaces such as the open market, crowded supermarket, and pharmacies. This is Abia State COVID-19 update. It is the 4th edition for the week. My name is Michael Oni. On this program, we highlight daily reports of the Interministerial Committee on the Control of COVID-19 in Abia State, and of course the governor's efforts, Dr. Okezie Ikpeazu, in ensuring that the state is safe from the virus. This program is running simultaneously every weekday from Mondays through Fridays on several radio stations in the state: BCA 88.1 FM, Flow 94.9 FM, Vision Africa Radio 104.1 FM, Buzz 89.7 FM, and Real 99.1 FM, all in Abia State. Now let me bring you up to speed on the figures, of course, and also updates on coronavirus globally first, then we'll come back home to the country. The global number of deaths stands at 711,313, which means over 700,000 people have passed away due to complications of coronavirus. And also we have the total number of infections worldwide standing over 18 million. That's 18.9 million people have been infected, although the number of recovered cases is at 12.1 million. Now, to the development, Donald Trump, the president of the United States, yesterday repeated that he believes coronavirus will go away, despite his top public health expert warning that it could take most of the 2021 or longer to get the pandemic under control, and that is that it is unlikely the virus can ever be eradicated. At a White House briefing yesterday, the United States President said COVID-19, except that of COVID-19, that he believes it will go away. And Facebook, the social media Facebook, removed a post by Donald Trump on Donald Trump's page for spreading false information about the coronavirus. This is the first time the social media company will be doing that, and that has been harshly criticized for repeatedly allowing the president to break its content rule. Well, WHO surge team arrived in South Africa. That was yesterday. The World Health Organization deployed a surge team of 43 health experts to South Africa to help the country deal with the pandemic, which has seen nearly 530,000 cases confirmed in the country, the fifth highest in the world and the highest in Africa anyways, and with 9,298 deaths recorded in that country. Now, in Nigeria, for 5 consecutive days, Nigeria has continued to record daily coronavirus infections below 500. Yesterday, 457 coronavirus infections were confirmed 2 days after 288 cases, the lowest number since the 8th of June, if you remember, and if you've been following the numbers right here on this program. The new infections were recorded in Lagos, the Federal Capital Territory, and 19 other states. Lagos State topped the list with 137 cases. Federal Capital Territory came second with 6 fresh new infections, 76 rather, fresh new infections. Abia State recorded 23 new infections yesterday also. And on a positive note, 314 persons were discharged yesterday. That's in the last 24 hours after recovering from the virus. Thus bringing the total number of discharged persons to 32,165. Sadly, unfortunately, 17 more deaths have been reported in the past 24 hours, and of course bringing the total number of fatality in the country to 927. As it stands now, we have 44,890 confirmed cases of coronavirus in Nigeria. Now let's turn our attention to the discussion for today. You know, schools have been ordered to reopen. They've been ordered, and the teachers resumed schools yesterday in preparation for the students in the exit classes to return back to school. Of course, they will be heading to write their finals as far as starting with WAEC. But this morning, we're turning our attention to the education sector, and we have the Honorable Commissioner for Education joining us this morning on Abia State COVID-19 update, Dr. Kale Nechi Wangwa. Good morning to you, Honorable Commissioner.
Yeah, good morning.
Okay, glad to have you this morning on Abia State COVID-19 update. We would like you to bring us up to speed in the education sector right here in Abia State as far as the resumption of schools is concerned. Give us an update on the plans to reopen schools in Abia State.
Thank you. In Abia State, we are doing our best to make sure that we will reopen. First of all, reopen, and we call that dry run. We started dry run on the 4th.
Okay.
Where we have all the teachers and health teachers on board. They are supposed to be there in school while we continue the preparations that will lead us to the return of the students next Monday, which is on the 10th. And in the course of doing that, the teachers have been helping in monitoring the cleaning of the compound, the process of fumigation that is going on, and the teachers are also going to for the COVID-19 test. So this process has been going because we want to make sure that before the students will come back, all the teachers will have been tested. And this morning, the teachers have gone. They are all taking one principal and one teacher, one head teacher and one teacher. They are going for training. The training that will enable them know how to operate both the thermometer and all the protocols. So that by the time the children will come back next week, they will have been trained to know enough about what to do.
Yes, go
that
on,
will
please.
help them to also know what to do. I
Yeah.
want to tell the students. So all these preparations are just in top gear. The governor have been very, very supportive. In fact, the governor, is providing the thermometer to the schools, the hand sanitizers, even to the students, and the face masks. So all these are wonderful efforts that the governor is making to see that the reopening of school will work out very well and things will go on well for our children.
Okay, I hope these plans that you've highlighted this morning on the program also covers the private sector. I mean, the private schools in Abia State.
Yes, this includes both the private and public and private schools. Like all the teachers in both private and public schools, they are all going for the COVID-19 tests.
So it means all teachers, those that are returning to school, must be tested. Is it? Are you doing more like a sample testing, or it involves all the teachers in the state?
It involves all the teachers that will participate in the revision and examination of the exit classes.
Okay, Honorable Commissioner, tell us about your engagement with critical stakeholders, including private schools, proprietors, parents, private sector participants, the Minister of Education, and the others. What has been... Okay.
Yes, at first we developed the guidelines by having consultation with all the groups. We did that with the PTA, we did that with ANCOF, we did that with NUT, we did that with NAPS, that is the private school proprietors. So then we developed a master guideline that everybody passed through. And then the governor also on Monday, on Thursday last week, summoned the education summit. And during that education summit, we got the stakeholders, including the university administration. They were all there, and we discussed. At the end of the day, everybody agreed to the guideline. So the guideline we're using now is a guideline that is produced by everybody, all the stakeholders in Abia State.
Okay, we want to know the progress concerning the fumigation of the schools also in Abia State, both the public and private schools. How about that? What is the progress?
Yeah, it's ongoing. It's a process. It's ongoing, and we know that many of them are going on today. Many have gone on before, and I hope that by tomorrow we will be through with everything about fumigation.
What happens to those teachers that may test positive to coronavirus?
Oh, certainly, we will have to send them to isolation so that they will go and receive the treatment. So we are not going to ask those who are sick to come and participate in the program for now. No, we won't do that.
Okay, I want us to be very specific here, Honorable Commissioner. The students also are to participate in the examination. Some may return because we cannot rule out all the possibilities. Some may return positive with the virus. Some may also test positive to coronavirus. How will they continue with their examinations?
Okay, what we are going to do, we have isolation center in every school. So when we have those food, they will be in that isolation where they will be taken care of, and then they will write the exam there. So we are not going to deny them the opportunity to write their exam. What we're going to do, we'll put them in that isolation where they are receiving their treatment, they'll write their exam from there, and then we will continue.
Okay, it looks like we're all focusing on the aspect of what the government should do. The parents, do they have some things to do also? Do they have their part to play in ensuring that we have a COVID-19 resumption for the schools in Abia State?
Yeah, as it is, we have been, this sensitization have been going on. So we are also expecting parents, even where we provide the masks and hand sanitizers, parents are also supposed to do their own part and then make sure that they bring their children to school and take them from school, because this is something that should be everybody's responsibility to make sure that while the government is doing it from this side, parents should also combine to help to make sure that all the effort, the protocols are put in place and they are in use.
Interesting. Honorable Commissioner, please, can you run through the guidelines again, for emphasis sake?
Yeah, the guideline, all the schools will have to be cleared and decontaminated and fumigated. And we are also expecting that they will have both the sick bay and they will have the isolation space. And then they will, anybody coming will have to be, the temperature have to be tested using a thermometer. And then they go through the hand washing protocols. After the hand washing protocol, then we allow them into the school. And then we're not going to run. We're going to have a physical distance that will ensure that the students will sit at least 2 meters apart, and that is already being enforced. As a result of that, we're not going to have general assembly during this time. But in the classes where the students are seated, they may have prayer in the class, and we're not going to have general break where the students will come out for outdoor play and all the rest of that. We're going to restrict it to just short breaks, every 5 minutes between periods, so that will help them to exercise themselves, but not going out to play a lot.
Okay. Doctor, I would like you to stay on the line so that we can get reactions from the callers this morning on the program, especially parents. But you've not touched another aspect. The tertiary institutions, they're also waiting to return back to school, just as other classes are also waiting to return back to school. How soon are we going to have that?
Yeah, that day when we had the summit, you were there when government said that they should go and then bring out their plan of action. Because generally what applies to primary and secondary will not apply exactly the same way with the tertiary institution. So they were asked to go and get out their plan of action, bring to the SSG so that we'll look at it and then give them approval to reopen like the other. So the tertiary institutions are also making they are working. Even ABSA has already set up a committee that will be responsible for working out their protocols and the guidelines that will guide them in reopening successfully.
Okay, well, I would like you to stay on the line, Honorable Commissioner, so that we can get reactions from parents and also callers of the this morning, the listener of Abia State COVID-19 update. 0808 182 6949 or 0811 605 2949. Also drop messages on 0906 510 8289. Hello, good morning to you.
Morning, Michael.
Yes, good morning. What's your name?
Good morning, my good expert in the studio. Good morning, all of you.
Yes, go on, please. What's your name?
All right, I remain Mr. Prince Lusuagu from here in Omonachogo.
Okay.
Michael, I'm very, very grateful on the measures being taken by the Abia State government, most importantly their governor. There was a statement I heard from him. He said, when other people will be crossing over Jordan, let his people not be included. And he has been the best. But my problem is this. If other governors in the parties are they not hearing what the governor of the state is doing? Like most importantly in my state, the opposite is the case in my state, which I'm not very, very comfortable. Imo State as a state, it doesn't have any industry but education. Why is our governor doing all this? Why would he take a stake from other states? So I pleaded with him, let governor follow.
All right, quickly wrap up your thoughts.
So that Imo State should follow that. In order not to cross the Jordan. That's my team.
All right, thank you. Hello, good morning to you. You're live on radio. Good morning. Hello, good morning to you. 0808 182 6949 or 0811 605 2949. Hello, good morning.
Hello, good morning.
Yes, good morning to you. What's your name?
Yeah, I am Uche from Umahia.
Okay, Uche.
Please, please, I want to ask, what about those living in boarding schools?
Okay.
What to do about that?
All right. Yes, Honorable Commissioner, did you get that?
Yes, he asked about those living in the boarding house.
Yes.
Okay. We have this provision because you see, we told them that it's highly advanced, but all those schools that are running boarding, we have a checklist that we are taking to them, and the moment we go through and discover that they have prepared well, we allow them to run boarding. So we are not preventing anybody from running boarding, but they must meet the protocols. Once the protocols are there, we allow them to run boarding.
Okay. Hello, good morning to you. You're live on radio. Move away from your radio set. Hello, good morning to you.
Hello, good morning, Mr. Michael.
Yes, you're welcome.
I quickly want to commend our governor.
Your name first, please. Thank you.
Okay, my name is Leo. I'm calling from Omaha.
All right, you're welcome, Leo.
Yes, I want to quickly commend our governor for what he's doing in Abia State. I love him so much. I thank him for fighting coronavirus with all ability that he has, with all the powers that he has. And I also want to plead that please, once the school starts and it's not working out the way, and the teachers are not doing it the way that it's supposed to do, let him quickly shut down the school because our lives matter. Thank you very much.
All right. Thank you, Leo, for your contribution. Hello, good morning to you.
Hello, good morning.
Yes, you're welcome.
Hello, Commissioner, good morning.
Yes, good morning.
Yes, this is Imam Benson. I'm calling from Akwa.
All right, go on.
Yes, please, I want to say something on the reopening of school in our institution. Please, I want to say if federal government accepts with us and you want to look at it, there is no higher institution that does not have a medical center. All the institutions, they are having medical center. All the federal institutions, they are having teaching hospital. So I'm pleading with the federal government that federal government should look onto it so that the final year students can go back to school and complete their education. Thank you.
All right, thank you for your contribution. Hello, good morning to you. Okay, we lost that. Finally, what will be your first line charge to those teachers resuming school, and also to the students, the pupils that are resuming from next week? Honorable Commissioner.
Yes, okay. Yeah, what we want them to do is that this COVID-19 is real and everybody should take responsibility. So while we are working hard here to make sure that the schools will be safe, they too should be careful to make sure that they remain safe so that they can come back and write the exam. And they should continue to be part of the radio program that is still on. We are doing that, and it's part of their revision that has been going on for a long time. So they shouldn't stop preparing, because the exam will not take too long after they come back before they write the exam.
All right. I want to really appreciate your time this morning on Abia State COVID-19 update. Dr. Kale Nechi-Wangwa, the Honorable Commissioner for Education in Abia State.
Thank you very much.
All right. Now you have an idea of what is happening in the education sector as far as COVID-19 is concerned. It is also very important that we keep staying safe. Coronavirus is real. Stay safe for yourself. Stay safe for your family. The program returns tomorrow. Of course, many thanks to the partner radio stations, BCA FM, Flow FM, Vision Africa Radio, Buzz FM, and Real FM. My name is Michael Oni. This is Abia COVID-19 Update. Abia COVID-19 Update.